Hello, class, and welcome to today's class where we will be discussing what abnormal psychology is and how it's studied and how it is defined. Now, abnormal psychology is the study of mental and emotional disorders and how they affect individuals and society as a whole. So the term abnormal really refers to any behavior or thought process that deviates from what is considered typical in a given culture or society, or what causes distress to the self or others. To understand abnormal psychology, we need to first understand what is meant by the term mental disorder. Mental disorders are conditions that significantly affect an individual's thinking or emotions or behavior. And they can be caused by a variety of factors. They can be genetic, biological factors. They can be factors within relationships or the environmental factors, or they can be disruptions in brain chemistry. And one important point to note is that just because someone is exhibiting abnormal behavior or experiencing abnormal thoughts or emotions, it doesn't necessarily mean that they have a mental disorder. And it's important to consider the context of the behavior and the individual's personal and cultural background before making any kind of diagnosis. Now, another important aspect of abnormal psychology is the study of how mental disorders are diagnosed and treated. And what we will be doing today is kind of introducing you to the basic ideas of abnormal psychology and how we diagnose disorders. So, overall, abnormal psychology is the application of psychological science to understand and treat mental disorders. So, in today's lecture, we will explore how we define a disorder. We will explore the history of diagnosing a disorder and what are the steps to going into making a diagnosis. And then we'll look at a few common disorders, and we'll look at, make it easy, we'll look at A's. But first, I want to start off with a story, like always. Now, the belief that the moon influenced people's mental states is an ancient one, dating back to ancient civilizations such as the Babylonians and the Greeks and the Romans. And the belief was based on the observation that the moon's phases seemed to coincide with changes in behavior and mood among individuals. That's part of the reason why we have these stories of werewolves, of people transforming into animals based upon full moons. In the Middle Ages, this belief was further developed and expanded upon with the idea that the full moon in particular had a powerful effect on people's mental states. And it was believed that during a full moon, individuals could become irrational or aggressive or even possessed by demons. And this belief in the moon's influence on mental states continued into the 18th and 19th centuries. And it was during this time that the term lunatic came into use. The word lunatic is derived from the Latin word luna, meaning the moon, because it was the lunar cycle that was impacting people. And it was used to describe individuals who were believed to be, quote-unquote, moonstruck, or influenced by the phases of the moon. Now, the connection between the lunar cycle and mental health led to the establishment of the lunatic asylum, which was designed to provide a safe and therapeutic environment for individuals with mental disorders. And so the first lunatic asylum was established in the late 18th century, and others soon followed in Europe and in the United States. Now, while the belief in the moon's influence on mental health has since been debunked, and the term, unfortunately, lunatic still pervades in popular culture to describe individuals with mental disorders. However, it is important to recognize the stigmatizing nature of this term and the potential harmful impact it can have on individuals with mental health issues. Remember, these are still people. So, the story for today's lecture is about the history of mental disorders and the understanding of mental disorders from the 1700s to the 1900s. And this period saw significant changes in the perception of treatment of mental disorders. So during the 1700s, people with mental disorders were often seen as dangerous and were confined to jails or workhouses. However, towards the end of the 18th century, as I've already mentioned, there was a shift towards a more humane treatment of disorders. And so the concept of the asylum was born, or the lunatic asylum. So the first lunatic asylum in the United States was established in 1792 in Williamsburg, Virginia, and others soon followed. These asylums were designed to provide a safe and therapeutic environment for individuals with mental disorders away from the harsh conditions where they had typically been housed in jails and workhouses. Now, one of the most significant figures in the history of mental health treatment during this period was Philippe Pinel, a French physician who believed in treating mental patients with kindness and compassion. In 1793, he was appointed as the head physician of a hospital in Paris, where he removed the chains from the mentally ill patients and introduced some more humane treatment. Now, in the United States, Dorothea Dix was a prominent advocate for the rights of the mentally ill. She visited many jails and workhouses in the mid-1800s and saw the appalling conditions in which the mentally ill were living, and she lobbied for the establishment of state-funded mental hospitals and was really instrumental in founding of several hospitals within the United States. Now, what kind of impact did this have on people? Well, one account of someone who was treated for mental illness during this time was Mary Reynolds. In 1854, Mary was admitted to the state lunatic hospital in Worcester, Massachusetts. And she was diagnosed with mania, which basically means out of control sense of euphoria, of happiness. Not a bad thing to experience, except for it can be very destructive because you lose the sense of danger, you lose a sense of consequences. And she was described as having wild and incoherent thoughts and exhibiting violent behavior. Now, Mary was treated at the hospital, which involved confinement to a small room with some restraints to prevent her from harming herself or harming others. And she was given some medication, and at this time you need to be kind of mindful that the medications were fairly primitive, so the medications she was giving were opium and chloroform, which obviously calmed her down. Mary's condition, though, did improve, and she was eventually discharged. So there was some positive cases that did happen during this time. The whole idea, though, is that we're starting to recognize that these people are not victims of demon possession, for example, but that they do have some kind of disorder that requires care, requires attention, requires focused treatment in a humane way, in a caring way, and hence the asylums, the hospitals. So let's continue on now and look at defining what a disorder is and what makes something abnormal. So we'll explore the difference here between mental health and mental illness and defining the characteristics of mental illness. So to begin with, mental disorders are conditions that affect a person's thoughts and emotions and behavior, or the combination of these. They cause distress to the self or others. And these disorders can range from mild to severe and can impact a person's ability to function in daily life. Now, determining whether a mental state is a disorder or abnormal or not is not always straightforward, as what may be considered normal or abnormal may vary across cultures and across time. However, mental health professionals use certain criteria to determine whether a mental state is a disorder or abnormal. And one criteria used is the degree of distress or impairment that the mental state causes. For example, if a person's anxiety is so severe that it prevents them from leaving their house, then it would be considered a disorder. Similarly, if a person's behavior is significantly impacting their ability to function in daily life, it may be considered a disorder. Another criterion is whether the mental state is persistent or recurrent. If a person experiences symptoms of depression for a few days or weeks, it may be considered a disorder. However, if the symptoms persist for several months or longer, it may be not considered a disorder. It may just be they're sad for a day, or they're having a bad day or a bad week. But if those symptoms persist, then it may be considered a disorder because they've been caught in some kind of cycle that is disrupting their function and causing significant distress. Now, let's move on to the difference between mental health and mental illness. Mental health refers to a person's overall emotional, psychological, and social well-being. And so it encompasses the ability to cope with life's challenges, maintain healthy relationships, and achieve one's goals. Mental illness, on the other hand, refers to a diagnosable mental health condition that significantly impacts a person's thoughts, emotions, or behavior. So the defining characteristics of mental illness vary depending on the specific disorder, but there are some general features that are commonly associated with mental illness, and these include things like distorted thinking. Now, distorted thinking within mental illness can cause a person's thoughts to become distorted or irrational. For example, a person with schizophrenia may experience delusions or hallucinations. They may see or hear things that other people cannot see or hear. Then there are emotional disturbances. Mental illness can cause a person's emotions to become extreme or unstable and cause significant disruption. For example, a person with bipolar disorder may experience periods of intense euphoria, just like Mary had done in the previous example. And then they might suddenly become depressed and not be able to get out of bed. There can also be behavioral changes. So mental illness can cause a person's behavior to become abnormal or erratic. For example, a person with borderline personality disorder may engage in impulsive or self-destructive behavior. So in conclusion, determining whether a mental state is a disorder or abnormal, it can be a fairly complex thing. But we have criteria as mental health professionals to determine whether or not this is the case. And so mental illness is something that's diagnosable. It's something we can focus in on. We can understand what's going on with the thoughts, emotions, and behavior of a person. So I hope that you appreciate that introduction to mental health and mental illness. We'll pause now, give you a little bit of break, and we will come back and explore what it takes to diagnose a disorder, as well as look at some common disorders and what kinds of symptoms make up those disorders and what is the cause and the prognosis, the outcome of these disorders. So I will see you in a little while. You take care. Bye-bye.